Hi everyone, this is chapter 25, the musculoskeletal system. Here are your learning outcomes. And this introduction is just an overview of your A and P, so you can read through that in your book. Special considerations, we're going to talk about these as they relate to the musculoskeletal system. Okay, so health promotion considerations, goals for Healthy People 2020. Most of their goals focus on arthritis and making sure that people are being screened for arthritis, have access to pain management, are able to do their personal care, and also covered is to decrease the risk of osteoporosis and also chronic back conditions. And you can read through these. Lifespan considerations. First of all, we have infants and children, and I think the most important thing here to remember is that bone growth is very rapid during infancy and steady throughout childhood. There are a lot of different congenital problems that can show up at birth, and so we want to make sure that these infants are being screened for any musculoskeletal abnormalities, and you will learn more about that in your maternal child unit with Mrs. Lott. Pregnant females, the cartilage in the pelvis is softening. There can also be strain on that lower back, especially around the lumbar area, and sometimes they will develop lordosis, which is a curvature of that lower lumbar part of the spine. As far as older adults, there are changes in the bones, muscles, joints, and the connective tissue. The bones change as a result of a decreased calcium absorption and reduced osteoblast production. Bone reabsorption occurs more rapidly than new bone growth in the elderly, and this is going to result in a loss of bone density. So height decreases from 1 to 2 inches between the ages of the late 20s to 70 age, and resulting in the shortening of a vertebral column, which is why it's very important for us to keep measuring height, especially in our older adults. Also with older adults, there's a decreased reaction time, decreased speed of movement, decreased agility, and endurance with aging. So lordosis is on the right. As you can see, this is common with pregnancy. It's the lumbar abnormal curvature of the lumbar spine. Kyphosis is more common in elderly, and this is an abnormal curvature of the thoracic spine. So you can see the difference there. So psychosocial considerations, we need to make sure that we're paying attention to this, because any inactivity may lead to trigger psychological disturbances such as self-esteem problems, hopelessness, social isolation. So again, we need to take this into consideration when we're doing our assessments. Also, consider physical abuse if the patient has a history of frequent fractures, sprains, or musculoskeletal trauma. Cultural and environmental considerations, race and ethnicity. Africans have a higher bone density, so they have less fractures. Osteoporosis is more common in women, Asian, and Caucasian. Curvature of the long bones varies by cultural groups, and it's related to genetics. Diet and weight are also very important because obesity is linked to the lumbar back pain. Participation in athletics and sports activities puts people at risk for sprains, fractures, and certain working conditions. Anybody who does repetitive lifting, construction workers are also at a risk for fractures and sprains. Also with work, repetitive movements such as sitting for long periods of time and having incorrect ergonomics can lead to things like carpal tunnel syndrome. So our focused interview, we need to know what's normal and how the musculoskeletal system functions and what's normal. Consider your patient's ability to participate, and if they are having any acute pain related to muscles, joints, we need to make sure that we're able to assess that and make sure we get them some relief. So, focused interview questions. We have general questions about anybody's mobility. Have they noticed any changes in their mobility? Are they able to perform all their regular activities, their ADLs? Illnesses and infections. We need to know if they have any chronic diseases such as arthritis, fibromyalgia, lupus, diabetes. Diabetes can also lead to osteomyelitis, which is an infection in the bone. Have they had any treatment, or have they had any injuries, any broken bones? Infants and children, again, we need to be looking as to whether there was any trauma at birth, and also as children get older, they're going to be involved in sports, so we need to make sure that we're taking that into consideration. Pregnant female, we talk about back pain. Older adults, we have weakness, we have prone to falls, and we want to know, do they use a walker, do they use a cane? We want to ask our patients if they have any family history of any chronic illnesses also. Rheumatoid arthritis is an autoimmune disorder, and there's a genetic link with that. So environmental, internal, that is going to be things like your weight loss or gain, diet and exercise, any infections, do they smoke? External are going to be things such as sun exposure. It is important that we are getting enough vitamin D because vitamin D facilitates the calcium absorption. We want to know what their work is, what their hobbies, what their activities are. So we're going to collect some objective data. We're going to inspect, palpate the bones, muscles, and joints for any deformities, any tenderness, and any pain. We're going to be assessing range of motion only on the joints that are listed in your practice rubric. So again, I'm going to be recording this for you to be able to look at. One of the things that's important, this photo here, is being aware of your landmarks when you're looking at the back and the spine. The top of the scapula and the top of the iliac crest should be level, and in this picture they are not. You can see that there is a curvature of the spine, so this is important, and I'm going to review that again when we are talking about scoliosis and back problems. So muscle strength is going to be the same as what you did with your neuro assessment. You have your upper extremities and your lower extremities, and they are rated on the scale of 0 to 5. And here's your documentation. And that's pretty much it. I will, like I said, I am going to be recording your musculoskeletal assessment as it is outlined in your practice rubric.